Variceal bleeding. Varices are abnormally dilated veins. Varices can rupture and bleed, and bleeding from esophageal varices is typically a medical emergency with a high risk of death. Variceal bleeding usually develops when normal blood flow to the liver is blocked, caused by a clot or scar tissue, particularly in the portal vein. Variceal bleeding often occurs in people with advanced liver disease, such as the liver cirrhosis. Esophageal varices happen throughout the GI tract, such as the esophagus, stomach, and rectum. Usually, there are no symptoms unless the veins bleed. The symptoms are vomiting blood, tar-like or bloody stools, and in severe cases, shock. Suppose there's a hose squeezing into the next hose. When a hose is having big blockage, there will be big backflow, 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 and the pressure is building up and it is causing vein to erode, and there's even more bleeding. This is how variceal bleeding is happening. The treatment of this is Terlipressin. This is for acute emergent vasoconstriction so that there is less backflow. Once this is treated, we change it to beta blocker, which is propranolol, for long-term prevention. Variceal bleeding.